for everyone. And by saying that, I mean everybody responds differently to different foods. So even if you have diabetes and your twin sister has diabetes, or a sibling, you may still have some nuances that are different. Like maybe oranges are okay for you to eat on an empty stomach, but not for your sister or your neighbor or whoever. So yes, there's types and styles of eating that are really, really good for diabetes. And we're going to talk about that today. However, and those types of ways of eating can help you to start getting on the path to reversing your type 2 diabetes. But it's not going to be one specific thing fits all. Like, it just isn't. That to say that here's the perfect diet, down to the dosage, the grams and how much you're supposed to eat. Obviously, it's different. We all are different. We have different DNA. We have a different genetic makeup. I might be, 20 pounds heavier than you are. So of course it's going to make a difference. All right. So let's look at some of these words. So did you know we used to call it type 2, adult onset type 2 diabetes? Do any of you remember when we called it that? I've been in nursing. I did my nursing degree 30 plus years ago. We used to call it adult onset type 2 diabetes. It was not called type 2. Why did we stop calling it that? Yeah, the sad news is because more younger and younger people are getting type 2 diabetes. We can't call it adult onset because it doesn't onset in adult anymore. It starts, teenagers are getting type 2 diabetes. That just goes to show you how influential our environment and our lifestyle is on the impact on this, what they call a lifestyle disease. They call diabetes a lifestyle disease, by the way. So did you know that 1 out of 3 people that have the beginnings of diabetes don't even know there's anything wrong? Yes, they feel crummy in the morning. Yes, they don't feel great and they feel tired in the afternoon, but they have no idea it's because of their diabetic situation. You might even know of a friend or two that's in denial and doesn't want to go see the doctor, but you know that they might be what we call pre-diabetic. So we call it pre-diabetic, which means your sugar level is not in the norm. It might be, it's a little bit higher, but it's not quite to the place that you would get the diagnosis of diabetes. So pre-diabetic, you can be pre-diabetic. If your doctor whispers the message of diabetes and your blood work's not looking very good, take note of that and start making some changes before it becomes full-blown diabetes, because it's way better to just like nip it right here than when you've already up here. All right. So, diabetes is not, it's not like, I want to say this, like with diabetes, anybody can get diabetes. It can run in anybody's family. You can be, skinny mini, you're not overweight, but there's the genetic code and in your, what was been passed down to you. You put yourself a bit more vulnerable. The weak link in you might be diabetes, like it is in me, or maybe it's, getting asthma. Maybe there's a lot of asthma runs in your family. There's a lot of things that can be hereditary. High blood pressure is one of those things. You might have like the perfect lifestyle, the perfect environment, and darn gosh, you still have high blood pressure. It could be hereditary. So, again, you can't beat yourself up over this. It's about what you do with it. So the next one on the slide is metabolic syndrome. I like to bring this one up because it relates kind of to diabetes. You can have metabolic syndrome and not have diabetes, or you can have diabetes and not have metabolic syndrome, and you can have both. So metabolic syndrome just is sort of like a thing where you got 5 risk factors happening at the same time. This group of risk factors is not good to have together because guess what? You're at higher risk of what things? Heart disease, diabetes, and cancer. So this one's not a good one. So what are the 5 risk factors? The first one is increased blood pressure. You happen to have sustained high blood pressure, not good. The second one is high blood sugar, which you have in diabetes, not good. The third one is having excess weight around your waist, not great. High triglycerides. Triglycerides are one of those things they test in your blood like cholesterol. They check to see what are your triglyceride levels. Are you eating a lot of bad fats? Your cholesterol and your triglycerides will probably be elevated if you're eating fatty foods all the time. And the last one is having low HDL. Ooh, that sounds good. but it's not, because HDL cholesterol is the good cholesterol. You want that to be high. HDL cholesterol, you want high. We need cholesterol in our bodies to lubricate our insides, to have our eyes work well, to have, I don't know how else to just explain it, but cholesterol is not a bad thing. It shouldn't be a bad word. LDL is the bad cholesterol. We want that down as low as possible. That HDL we want nice and high. All right. So those are the 5 things. So you can see that if you have diabetes, you probably have that high blood sugar. You're on your way to maybe possibly getting metabolic syndrome. Or maybe your blood sugar hasn't been so bad for so long that you've got metabolic syndrome, but diabetes hasn't developed yet. So you can see how they kind of go hand in hand a little bit. All right. What are the risk factors for type 2 diabetes? Are you worried? My big one, we'll get to that one, but if you smoke, higher risk of diabetes. The weight around the middle, or just being obese, puts you at higher risk just because of your weight. Sedentary lifestyle. Are you sitting most of the time? Are you moving your body? Are you sitting a lot of the time? Are you not doing much? You're not moving your body and your limbs. Are you eating a bad diet? Do you eat processed junky food and sweets and fats? Are you eating high triglyceride foods? Those are really the bad trans fats, like that's when your triglycerides go up. Do you have the low good cholesterol? So you don't have any good cholesterol in your body that your body processes need. What about ethnically? Are you Hispanic or Native American? Or are you Asian? I'm considered South Asian, I guess. I find that funny to think of myself like that because I was born and raised in Canada, but I might have a South Asian background. And African American. Unfortunately, my group and the ones I just said were all at higher risk of getting diabetes. It doesn't mean that the Caucasian person, like my husband's Caucasian, doesn't mean he can't get diabetes. It just means my culture is at higher risk of getting it. Family history also puts you at higher risk. So, you could just be, family from Midwest and, but diabetes runs in your family. Then that puts you at higher risk. Even just turning the age 45 now puts you at higher risk of getting diabetes. So those are all the risk factors for it. So what does it mean actually to have type 2 diabetes? Now, I'm not going to take a census here to say who actually has diabetes and who's just interested in the topic. But for all of you that have diabetes, how do you explain it to somebody? If somebody asked you what's wrong, what does it mean to have diabetes? Would you know how to explain it to somebody? Like even if it was your 12-year-old son or something, how would you explain what diabetes is? Anybody?
I just say that it's a sugar disease and you can't eat sugar.
Yeah, I mean, that's in the simplest way of explaining it. That's the best way to explain it, is to say, yeah, it's a sugar disease. But what happens is when we just call it a sugar disease, we all know that humans, we're all attracted to sugar. We all eat sugar. Even when we're diabetic, we still eat some sugar. And it just kind of takes away from really kind of understanding what's going on in the body. So what I want to explain to you is what's going on in the body. It means that your body has some kind of interference in the ability to break down and metabolize carbohydrates. That's what diabetes is. Your body has some kind of issues with getting the carbohydrates you eat, like the bread you eat, and breaking it down properly so it becomes energy and not sugar, glucose sitting in your bloodstream. Your body has not got a good mechanism to like break it down and make it useful to the brain and to all the parts. And then you got nice clean blood. It just has some kind of interference happening with being able to do that. So you could easily say to somebody, yeah, when you have diabetes, you have a hard time breaking down carbohydrates efficiently. You could say that. If it's a younger person that just isn't quite understanding, you can say, yeah, mommy or auntie or whatever, my body has a hard time breaking down certain foods to use for fuel, and therefore it sits in my system too long. Something like that. But really, when you have chronic high blood sugar, when your blood has the sugar sitting and floating in it, that's when you develop all these other problems. That's